and grateful that you all came out today to sort of join us in this discussion. I will say I know some of you, but not all of you. So for those of you who don't know me, my name is Cameron McConkey. My pronouns are he, him, his, and I'm a board member of the college's Board of Diversity, Equity, and Inclusion, as well as a graduate student here in the School of Public Health. So before we get started with the conversation today, I did just want to sort of remind everyone about how this panel sort of came together, because it's going to inform a little bit about how this conversation flows today. So a lot of you, I think, registered in advance, and in that registration process, you had the opportunity to share comments and questions with the panel that may be of interest to you. And so I was thinking in preparing this panel that I was going to have to do a lot of work myself around developing questions and sort of the flow of this conversation, but you all did that work for me. We had an incredible number of questions and comments submitted to the point where I actually had to sort of narrow down how this conversation would look today. And that's really exciting. I mean, I was really sort of floored by how enthusiastic everyone was about this conversation and about learning about these topics. So that all being said, I did just want to sort of lay down some ground rules about how this conversation might work today. We're going to cover some questions that may not have been raised necessarily in open dialogue recently, as well as some sensitive topics. And so I had some ideas about how that might work. And so this first rule that I made up is totally my own. And so if you love it or hate it, please let me know after the fact or in the evaluation, because I've never tried it before. But it felt important based on how we sort of set up this conversation today. And so I call it the anonymity and voice rule. And the idea is that when you all submitted questions and comments to the panel, that was framed in a way that it would really only be us reading them, and that they would be potentially posed anonymously to the panel. And I want to respect that and allow you to sort of be anonymous in your identity behind those questions and comments. But on the flip side of that, I also really wanted to recognize that some people feel strongly about having their voice heard in this conversation, and I want to sort of respect that as well. And so the idea about how this will work is that when we get to the conversation piece today, if you see a quote or a comment or a question that you raised in the registration process yourself, and you would like to be the voice behind that, just go ahead and raise your hand, or if you're online, just unmute yourself and make a weird noise or something, and I will sort of tap you in to read that question or comment yourself. And when you do so, I ask, if you're welcome to stand if you want to. You're also welcome to introduce yourself. Just a first name and pronouns would be great. Read your quote and then sit back down. If at some point through the conversation you would like to acknowledge that the question or comment was your own and you'd like to elaborate on it or sort of emphasize something, but you didn't necessarily feel comfortable standing and reading it yourself, you can always sort of identify yourself after the fact in the same way, and just be like, yeah, that was my question. You didn't interpret it quite right, or I have a follow-up question, just let us know. And then obviously the third option, if you choose just to remain anonymous, that's cool too. And in which case you would just do nothing and we'll sort of have the conversation around an anonymous question. I think there are also some agreements that are important in having conversations like this. And so I adapted this from a lot of material that's used in gay-straight alliances. So this agreement sort of list is not my own, but I think it's really important. So the first one, and probably most obvious based on the title of the presentation today, we're going to respect people's pronouns. The way we'd like to do that is when introducing yourself, if you could just share your pronouns with everyone, that would be great. If you're engaging in conversation, either in the larger group or with your small table and you don't know someone's pronouns, feel comfortable to ask. And then the rest of them are sort of just basic questions. When someone's talking, we should all be listening. I'd like to extend that to technology, so just to minimize our time on phones and computers would be great. The Vegas rule, so what's said here stays here and what's learned here leaves here. This one I think is really important too, so take space, make space. If you're not familiar, this is sort of an agreement that requires a little internal reflection about who you are in a group and whether or not you're someone who tends to take up space by talking or asking questions or providing commentary, to maybe sort of realize that and check that and take a step back and allow some people who are normally more of the wallflowers in the group to have an opportunity to also be part of this conversation and dialogue. I also think it's really important that we use I statements. So this is important to acknowledge that everyone is certainly entitled to their own beliefs and opinions, and I expect some differences in those today. But that by using I statements, we sort of acknowledge that those are our own, and that we avoid using sort of sweeping language that encompasses, large groups of people or communities, even if those are communities that we include, that we sort of recognize and that we are a part of. And then lastly, I just wanted to share that we are all learning. So I learned an incredible amount about Drexel University in preparing this talk today. And so I'm excited to share a lot of that with you. I'm excited to learn a lot from all of you. And just to recognize that we're all sort of in different stages of this learning process, and that's okay. And as long as we sort of follow these group agreements, we should be in good shape. So is everyone sort of on board with all of that, or have questions about how that might work? Something else they want to throw out there? Anyone online, you're welcome to always sort of unmute yourself and join us. I know we can't see you, but we would love to hear you too. Okay. So before we get into the conversation, I think it's always important to talk about why we're here and the significance of this. And again, this was something that I really thought I was going to have to sort of develop myself, looking at statistics or about past sort of trends here in the college or the university. And that proved to be not true at all. So a lot of you shared some incredibly touching and powerful stories and commentary when you registered. And it left me realizing that, those stories alone are a perfect sort of explanation of why we're here, and that I don't really need to say much at all. So this will be our first sort of trial run of the anonymity and voice rule, because these are your own quotations. So if you are here today or online, and you see your story and you'd like to read it yourself, you're more than welcome to, obviously. So this first quotation is around family and family inclusion. And this one was really touching to me, really spoke to me personally. So if you're here, you'd like to read this, let me know. But this quotation here reads, "My teen son identifies as male and is part of the LGBTQ community. As a parent, I want to be a resource for him and be able to talk with him about his life without offending him or anyone really. This is all pretty new to us, so I just want to learn all that I can so I can be a better parent, a better mentor, and more of an advocate for him. I hope to learn and understand more language and be able to expand my thinking." So thank you for sharing that. It's really great. So this is one that we're going to talk about probably a lot today. This one really also spoke to me pretty personally in my role on the diversity board. So if you're here and wanted to read this, but this comes from a member of CNHP's community. As a trans non-binary person, using the restroom can be uncomfortable. Every time I enter the women's room, it feels like I'm negating my own gender queerness. Okay, so this one comes from a faculty member, also I believe here in CNHP, if you're here or online. But otherwise, this reads, "I teach 400, and I'm going to assume this is anatomy and physiology, students per year who will be the future of healthcare and who are also dealing with issues of stigma. I want my classrooms to be a place where all feel welcome and respected, but I'm unsure how to address this."
Hi, that's me, Krista.
Awesome. Thanks, Krista.
No problem.
And then lastly here, this one speaks, so we have a lot of professional staff here, including new staff. So I'm a new employee at Drexel, and I'm keeping an eye for hands, so you can tag in if you ever want to. So I'm trying to learn as much as I can, and I'm very interested to hear about Drexel's gender inclusive practices. And we're definitely going to be talking a lot about those today. And so lastly, before we jump into introducing the panel and the conversation, a lot of the questions that came in, I wasn't able to include in the presentation because there were so many of them, and a lot of them were around language and around pronoun use, and we're going to talk about that today for certain, but I thought that this video, it's short and it does a really good job of addressing some of the points that came through the registration, and I also think it's a great opportunity for me to sort of take a step back and be quiet and allow people who really have a lot of lived experience with this to sort of share some of their own stories with all of you, because I think they're incredibly powerful and do a much better job of sort of explaining why we're here today. So hopefully this works.
Pronoun.
You can call me he, you can call me.
And I just want to pause because I forgot. So this is a video that does Basically what they've done here is that it's a word association video. So they've asked people who are trans identified themselves to tell us what they think about when they hear the word pronoun. So that's what you're seeing a response to here.
You can call me Regis and Kathy Lee.
Simple. Pronouns are not hard, but people's understanding of them apparently is.
Simple.
Simple. You know, I just feel like I'm not stabbing myself in the leg every 7 days with testosterone for them to call me she.
Respect. I think it's always important to ask someone what they use, what honors them, and to use that.
Gender, the way people look, isn't necessarily descriptive of who they are inside.
Difficult. As someone who considers themselves non-binary, I have a lot of trouble interacting with people who've never interacted with someone who uses they, them pronouns.
When people hear that I use he, she, and they pronouns, I think they get a little bit nervous, because what if they start using one pronoun and then they say a different pronoun in the next sentence? Then everyone will think they messed up.
He, she, it, they, it's just a word.
I don't like it when people call me a he. I feel like they need to be corrected right on the spot.
When someone knows about my fluidity and chooses a pronoun that resonates well with me in that moment, yay.
Key to educate oneself about who you let into your life and how they want to be identified.
Useful. If anything, I'd be more hung up on the need some people feel to attach preferred. That could give people an inaccurate idea of what being trans is, because my pronouns aren't preferred, they just are, because my gender's not, you know, a desire that I have or like a wish or something. It's who I am. It's just part of me.
Useful. I mean, it's easier to talk to somebody when they know how to address you.
Feel good about pronouns. It feels great to have the ability to choose your own pronouns.
Constant. That is a thing that I constantly have to fight for. All my friends and family are on board, so I don't have to worry so much. But I always worry about what pronouns strangers are using for me in their heads, which is really just a silly thing I should not even be thinking about.
Individuality. Given they might not know how to address you unless you tell them, or if they ask and you answer them.
I would say patience would be the word I think of. When somebody uses my pronoun, I don't get angry, I just re-correct them and help them really understand, the importance of how misusing somebody's pronoun could be offensive.
Identity, and you better get it right. In the workplace, people who persistently misgender you are actually guilty of sexual harassment. So what's more important, how you see me or respecting how I see me?
Pronoun.
Can you hear me? Okay, cool. So I really thought that video did a great job of addressing some of the points that came through in the registration around pronoun use, around the issue of attaching things like preferred to that, around sort of how this all plays out in the workplace, and we're going to talk about a number of those things today moving forward. So at this point, I want to stop talking as much as I have been and introduce the panel that we have with us today. And before we start here with Lane, I just wanted to point out that Dr. Joseph Salomon, who is our university registrar here at Drexel, had a family emergency, and he is very, very sorry and sad that he could not make this panel today. In the email that went out to all of you, you should have gotten his contact information. He's been instrumental in implementing some policies that we're going to talk about today at Drexel, some really great gender inclusive policies. And I'll point out what those are when we get to them. And then if you would have any follow-up questions about them or recommendations for future sort of action, he by all means encourages you to reach out to him directly and wanted to make himself available for that. So, Lane?
Hi.
There you go.
Hi, ooh, there I am. My name is Landa Flavas. Thanks for having me. I use he, him, his pronouns. I identify as white, identify as queer, identify as a trans man, and as a man. I work currently, I'm a clinical social worker. I work predominantly in private practice and also as a clinical supervisor and as a therapist at the Therapy Center in Philadelphia, which provides services for women and the trans community.
Good afternoon, everyone. My name is Rima Malhotra. I use she, her, hers pronouns. I work in the Office of Equality and Diversity as their education and prevention specialist here at Drexel.
Hi, everyone. I'm Christian Jordell. I'm on faculty here at Drexel. I use the pronouns he, him. I am a licensed marriage and family therapist, certified sex therapist. I identify as white, cisgendered, gay, and specifically, I work a lot with clients around issues of gender, gender identity, gender expression. Thank you.
So before we get into our first question, I just wanted to share 2 more slides, and that is I think that the interest in this event alone is really a huge success. This is the registration numbers as of this weekend. So we had over almost 50 people register for this event across multiple colleges and institutions. I was talking to someone here earlier who's from the Office of Research who's looking at this from their sort of administration's perspective. Students, faculty, alumni who are in sort of local organizations that were interested in this. So, I mean, I think this is really the start of a much longer and much more complex conversation, but it has to start somewhere. And I thought that this was really sort of touching that there were so many people interested in this. Thank you. And because it is a learning event, we have to do this one slide of learning objectives. And so our goal really is to develop an understanding here and sort of to open a dialogue around all things sort of gender inclusive and gender affirming, whether those are services and resources, policies, best practices, language. And so these are sort of the learning objectives that were outlined in the registration and evaluation. So with this, we're going to jump into our first question. And I think much more than maybe the stories at the beginning, I do just, again, want to honor that if you feel comfortable and would like to pose this question to the panel yourself, you are more than welcome to. Otherwise, I'm happy to read it. I have ideas about who on our panel might be best sort of poised to answer or start a conversation around that question. But then at that point, it's really a sort of an open and informal dialogue. I'll moderate sort of as little as I can. And then if you have any sort of follow-up or elaboration, by all means, just raise your hand and try to respect when other people are talking, and we'll sort of get through as much of this as we can today. So these are all questions that the audience has raised. I did not develop any of these. And so the first question that was raised here, and again, just shoot your hand up if you would like to raise this yourself. But the question that came through was, what protection do trans students have? And I copied this question verbatim, partially because there's a great example of inclusive language right in the question itself. So the asterisk or wildcard there is really, an inclusive strategy for talking not just about transgender people, but it can also include non-binary and genderqueer folks and other sort of gender minority individuals. And so we will definitely talk about protections and supports that specifically trans students have here at Drexel. But I did sort of, with permission, also want to open this question up a little bit to maybe rephrase it as, what protections do gender and sexual minority students, staff, and faculty have? Because you're going to find that a lot of the answers are the same, and we have a pretty diverse audience here. So we'll sort of circle back to the student supports, but Rima, if you wouldn't mind,
sure.
Maybe taking a first go at some of the protections, and I have some of the OED policies on slides here if we want to reference them. Yeah.
So here at Drexel, we have our discrimination, harassment, and bias incident prevention policy. So this protects students from discrimination and harassment and bias incidents based on gender identity, sexual orientation, gender expression, as well as many other protected classes like race, religion. I think they are all lined out right on that policy on the slide. But it's a pretty extensive and long policy that goes through every possible way that we can protect any Drexel student, faculty, staff, guest, patient, anyone that is a Drexel affiliate.
And then maybe related to that, do you want to talk a little bit about the OED3 policy and how maybe, you know, if there are incidences of bias or discrimination, sort of what that looks like?
Sure. We also have a sex and gender-based misconduct policy. So this is typically more related to sexual misconduct. So sexual assault, sexual harassment, intimate partner violence, stalking, sexual exploitation. That's going to be based on sex or gender identity. And I mean, in terms of what we're seeing at Drexel, we do receive reports of all of these issues from all different types of people, whether it is student, faculty, staff, and our real goal is to make sure that folks that are attending Drexel or are coming to our campus are feeling safe when they are here. So we want to make sure that folks are receiving resources, receiving those options, regardless of what the issue is. And if it's something that doesn't directly associate with what our office does, we're still going to have that student or faculty or staff person come in. So again, we can get them to the right source and provide whatever option or resources that they're looking for.
And I thought when I was reviewing this policy, one thing that stuck out to me and I highlighted here was sort of how expansive it was, not necessarily, well, also including the number of protected classes, but also where it sort of applies, both on campus, off campus. I think this is particularly important at CNHP. We have a really large online community. And so could you talk about how this applies to maybe like distance faculty or students?
So any of our policies will apply to, again, anyone, regardless of where the incident happened and when the incident happened. So it could be something that happened before you even came to Drexel, and you can still come to our office and receive that the support, resources, and different options. If it's something that doesn't involve another Drexel person, if it is another student that attends a different university, if it's someone that goes to a university in a different country, that's something that we can assist with. If something happened to you and you are associated with Drexel, we want to make sure that you are safe and you are okay and you're taken care of.
Great, thank you. Before I ask the other panelists about elaborating or to see if there are questions about this this topic specifically, I also wanted to put this into a little bit of perspective. So if this all sounds really great about what's happening here at Drexel as far as protections for gender and sexual minority students, staff, and faculty, it's true. Drexel is doing, I think, a really good job in those policies and in those regards, but that this isn't the case for everyone. And so even here in our home state, if this is your home state of Pennsylvania, this is a huge issue that's been on the sort of legislative table for a number of years. So the state of Pennsylvania does not have specific non-discrimination protections for LGBTQ folks in our state bylaws and legislation. So outside of Philadelphia County, which has since adopted those protections in rural parts of the state or in other areas of the state of Pennsylvania, and certainly across the country, this is not always the case. So while you are sort of protected as a Drexel affiliate, there are many people who still do not have these protections in their workplaces, in their school environments. And so I wanted to put in perspective that Drexel may be setting a pretty high bar, but that's not the case for everyone. So are there any other questions around these two Drexel policies and maybe how this all plays out, or does anyone else want to elaborate on anything before we go to another question? Yeah, sure. You got to get to green.
I guess I have a question for the room, myself included. I guess what I wonder about is if I think about making a report, what do I feel like are the deterrents to doing that? One of the things I think just being aware of these policies, sometimes I'm not aware of sort of things like this, but then I think about if I am aware, what might be sort of the reasons why I don't make a report. And I'm wondering if anyone else might have answers to that question or thought about that.
I think the one thing that comes to mind, if it's something that I feel like might have happened to me, am I misinterpreting what happened? Did it really happen? Am I making too much of something? And so whether or not it's, is this my perspective or is this something that truly happened? And so wondering if I make that, what will happen if, to me at work, to that person, That person could be someone I work with every day, and I'm going to continue to work with every day. So I think there's that question. And I know I've spoken to students, and sometimes they are saying those things as well.
Rima, do you want to maybe share a little bit about, because I know you and I talked about the process and how that unfolds and maybe the different tiers.
Before going through process, something else that we frequently hear from students is, well, if I make a report to OAD or to anyone at the university, my parents are going to find out. If I'm not out yet, how is that going to work? And then they don't come to us at all. So we're going to dispel that right now. No one's ever going to find anything out unless you want them to. Whether you are, again, a student, faculty member, staff, the only thing that happens when a report gets made to OED, whether it's from yourself or from a mandatory reporter, we get like the information from whoever it is, and then we're going to send an email, and it says something like, hey, we heard that you may have been impacted by something that falls under one of Drexel's policies. If you want to talk about it, let me know. And then if that student or person doesn't respond to us, we'll send a follow-up email in about 2 weeks saying, hey, I didn't hear from you. If you want to talk about this now or any point in the future, we're here for you. And then that's it. We are not going to force anyone to talk to us. We're not going to launch an investigation without anyone's permission unless there's a safety issue for Drexel's community. So we really want to let people know that there is so much autonomy in our process that, again, we are not going to force anyone into doing something that they are not ready for or that they just don't want to do. But we do want to make sure that students, again, anyone, are getting those resources. If you do respond to our email, you can come in and have a conversation with me or another Deputy Title IX coordinator, and just, I'll connect you to the counseling center, or we can talk about housing. Like, it doesn't always have to, if I meet with OED, everything is going to blow up, there's going to be investigation, I have to talk to the police. Not unless you want to.
Does anyone else have a question or follow? Yeah, sure, in the back.
To answer Christian's question, for me, I think one of the reasons that would stop me from disclosing is climate and culture. And I mean climate and culture like around our society, and then also like within our institution specifically. There was, I think, a hate crime that happened on the dorms just a little while ago, and there was a response from leadership, and there was like, which was great, but then in that response, there was also like, whether or not this was, if this is just blatant ignorance or if this is actually an incident of bias. And as a person of color, I was automatically a little bit turned off by that, because it gave this assumption, well, it just could be ignorance, and then it invalidates my experience, right? And that doesn't make me feel safe to then disclose these incidences that are happening. So really, what is the response of the institution or the society going to be? Is there restorative justice, or I'm just going to be re-victimized again? That's important for me.
Yeah, I mean, I think that's definitely a very well taken and very honest and true point. I don't, Rima, if you have maybe a follow-up to that around sort of just the administrative culture. I mean, it's a tough one.
It's difficult because on my end of things, I don't work too closely with the higher ups, like the specific people that might have handled that specific incident that you're referring to. On my end, we reach out to the impacted students who were impacted by that at that time, and then make sure that they are okay in that moment. And moving forward, that they feel safe in that specific residence hall, that they feel safe with the people that are surrounding them. But I couldn't really say much to the specific response to that, unfortunately.
And it sounds like maybe what happened there was more of like it's a communications issue of how this information was then communicated back out to you, or and maybe not how the situation was handled internally. But I mean, it's still a huge issue with regard to how that's communicated back out to the community. Yeah. Yes.
I just wanted to, thank you for saying that. It's not, I don't think it's a communications issue.
Okay.
I think it speaks to how the university takes these matters. So I think, to reiterate, I was thinking the same thing. People don't report because they're afraid that nothing will be done, or that it will be brushed aside. There are many people that I know who have had things happen to them, and because when we're talking about these things, because it's happened more than once, it sort of feels like, well, this is what the culture is, and the culture is you don't
Absolutely.
say anything.
Thanks.
Mhm.
Yeah.
I think that what drives my question is this idea of what lies beyond protection and what it means to create sort of an inclusive environment. And I think that to some degree, what I think, I'm struck by the comment and sort of my role as a faculty member, the quote in one of the slides, this idea of how do I create that environment? And I think there's a tremendous intention, certainly in this room, to want to do that. But the way in which I feel like that my role, especially as faculty, is to recognize the points of my privilege, my whiteness, my cisgenderedness, and how it is when I am interacting in those moments with people in administrative power, how I am voicing, my challenge. Because I think sometimes I'm acutely aware of that there are individuals in the college, students, faculty, staff, who ultimately identify with multiple minority locations, and they have a lot more risk. And I think that, I just want to reiterate that to me, when I think about how I personally am trying to navigate and create that affirming environment, I think it's through being aware of my privilege and using it.
Hi. I think as when we hold any marginalized identity or multiple marginalized identities, we have no reason to believe that the system is going to support us. Like, we have no evidence to back that up. The times that outweigh being supported by a system, girl. So, it really is like every morning I wake up and I put on my thick skin suit, because I'm prepared at any moment to experience a microaggression where I'm left feeling, oh, wait, am I crazy? Did that person really just do that? Like, was that intentional? No, I'm crazy, right? I experience a microaggression or like a flat out aggression where my life is threatened or something really violent happens towards me. And I expect that to happen every day. And I don't expect the system to support me because I've never had any evidence where it does, right? And so it does take identifying, and for me around my whiteness, like how can I as a white ally stand up and support folks of color, right? But the reality is that as allies, your role is key because they're gonna listen to you more anyway, right? Because you're white and you're cis and you're straight, right? So we need allies to really start practicing mindfulness around what they're hearing happening and stand up, say something. All of my best friends are whistleblowers, and I encourage you to be one too.
So I think at this point we will move on to the next question. I promise the conversation will stay just as complex. And so I guess before we move on, I did promise that in going back to that first question around student support, I did want to highlight a couple of things here. So on everyone's table is a new resource that was put out by the Counseling Center. It was an initiative that was sparked by the Gender Inclusive Drexel Committee. And so this is a resource for students, and this is the one that's on your screen. And this is about the student insurance policy guidelines around gender reassignment, hormone therapy, and all things sort of gender affirmation with regard to our student population. That committee is presently working on a similar sort of brochure for staff and faculty. It is different insurance plans for staff and faculty than it is for students, so there's some different details in there. But I wanted to make sure everyone walked away with one of these and to know that it is available on the Counseling and Health website, and you all have hard copies now. And this is something I think, as allies, like Lane was saying, we could do better about sharing and being open about these resources and making them available to the students that we engage with. The women's care, yes?
I have some questions about this pamphlet. Like, when was this made?
This was, to my knowledge, this was made very recently, like in the fall or winter term.
Okay, so why is it stated gender reassignment surgery instead of affirming surgery? And why in here is it Oh, God, none of this would pertain to me. I'm not female to male person. I'm a non-binary person. So the language in this is like awful.
This is insurance language.
Yeah, I'm here with you and for you. I'm a person that also, as a therapist, I write these letters all the time for non-binary and trans folks. Like I've written like countless letters to the insurance companies, and the language is totally disgusting. It is the insurance company's language, right? Now, all insurance companies are different. I'm assuming this is like what Drexel students can buy into.
This is
Aetna. Yeah, so I've written lots of letters to Aetna. With the changes made in the DSM-5, affirming surgeries are allowed, of course, for non-binary folks. It's just like, as a person who writes the letter, like I have to make sure I can say whatever I want as long as it hits these certain points. But these requirements are gross, and they're also stated by the insurance company, and we don't have a whole lot of control over that.
I just thought it was really important to mention for like any cis people here that like this language is like really disgusting.
Yeah, no, I appreciate that a lot. And I think something that I'll do is I'll go back. So I know the people who are in charge of putting this together at the counseling center. I'll return to them and see, and sort of stress to them that as sort of a forward-facing document to see what sort of flexibility there is in getting away from the insurance mandated language and putting something that's much more inclusive for the people who are reading it. Because obviously this is not the insurance company reading this, this is our students. So to the extent that this could be adapted to be much more inclusive, I'll definitely stress to them, and I appreciate that a lot. And to share with the room that, yeah, some of the language, let's focus on the language that we're talking about and not what's in this brochure, because this is very insurance-centric. And then the last point I just want to make in talking about not so inclusive language. So this is the Women's Care Center that doesn't just serve women. And I think that's very important to know. So this is a comprehensive care clinic for people who are male, female, or gender non-binary, identified, transgender identified, and there's some comprehensive sexual health care, pregnancy testing, contraception, PrEP for HIV prevention. So this is a resource that's available through the College of Medicine as well. If student health isn't quite cutting it for some of your needs. All right, so we're to our next question. So this one, if this is, yeah.
So I just wanted to stop for a sec. I'm just struck by in probably 10 minutes, we had 3, so the Women's Care Center that isn't just for women, the brochure, and then the language and the email that went out about the hate crime bias incident. So I guess I'm sort of where communication and language are part of culture, reflect culture, it seems like maybe where our intentions aren't matching up with our communications. So I think we could do better there, or I don't know, I just thought that that's kind of interesting. I don't think that communication is separate from the culture.
Yeah.
Totally right.
I think it's an extension of the culture.
Yes.
And we're doing it. All Luddites. I think I have a question for myself and anyone in this room who would identify as cisgender. So how would you feel if someone used the pronouns that don't fit for us? Would I catch that in that moment? Would it feel uncomfortable for me? How would I react to it? And I think that arguably, to the point of this brochure as an example, and to your point, Kate, to me, these represent both aggressions, microaggressions, but also missed opportunities. The idea of having the intention of going into that policy and having language that speaks to, this is the reason why we are using these terms which are offensive, and or thinking about how incidents are going to impact the entire community and specifically communicating proactively around that. I think that for me, where it begins is really being aware as it relates to gender of how my sort of cisgenderness leads me to be blind sometimes to these moments. And so I do think that it's about catching oneself. And I think, unfortunately, a lot of individuals at the administrative level have not always necessarily done that work, or at least I'm not aware of it.
So can I say that I'm Kate from PT. I usually practice this. I don't do it often. I use she, her, one more. Hers, thank you. And what I find frustrating is that we, when you talk about like what are the big initiatives in the university, diversity and inclusion comes up every week. And so what's going to start, what is starting to happen is that, well, you know what, if it's this big broad term, but then these little things are happening, my concern is people are going to just start turning a deaf ear because it doesn't feel like you're being heard or things aren't really changing. This is the in thing that administration should be doing. And so they're doing it in the broad term. And then the selective people or the people that are personally affected are recognizing that it's really not trickling down. It's increasingly frustrating. I mean, we've had this new position in our college, a dean of diversity and inclusion, for how long? And these little things are still happening. I mean, that's extremely frustrating to me. Yeah. And I'm representing this university. And I recognize my privilege, so it's frustrating.
So go do something about it.
I'm here. I'm doing something. Yes, right. But I mean, I see what you're saying as far as I looked at that and I thought, why is that? Yeah. Why are all these things happening? I mean, I have suggestions about how that brochure could be reworded.
Yeah. Thank you for sharing. So if it's okay, I'm going to jump ahead to the next question because we have quite a few. And this one is, the first few are going to be related here, so I feel like we're going to cover some similar ground. So this one asks, what resources can I guide my coworkers and peers to so that I don't have to educate them about my they, them pronouns?
The internet.
I would.
You may have heard it. I think it's dead. It's dead to me.
I was just being sassy and I said, the internet.
Here's a great example of the internet. So this is mypronouns.org. I tend to like, if you want to find like a sweet spot on the internet, this one's not bad. Particularly for people who are kind of new to this conversation. I just like the way this is organized because the tabs at the top tend to walk people through their own sort of internal dialogue of like what and why do we care about this and what are they? How do we use them? What do I do when I make a mistake is usually a quick question. And then to the end of sharing and asking about pronouns when you get to that point where you're comfortable. So this is one example of hundreds on the internet about where someone can be directed. And I think from my position on the board of diversity, it's also really critical in taking your point very seriously that we could be doing more to educate people in this college around what to do around this topic of pronoun use. And there are some recommendations coming from the Drexel University system, but I think here at CNHP we have a lot of sort of freedom to make this information as available as possible, and to have conversations like this today around what to do in cases like this. Yeah.
I know you said it sassy. However, I was like, I agree with you.
This was my question. Hi,
oh, yeah.
My name's Cheryl. I use they, them pronouns. And I would love to be able to feel sassy with my coworkers and
just
peers,
lean into it.
I have to see these people every day, and there's no culture around they, them pronouns in this university, or even pronouns in general. And I don't know, it's not something I guess I can lean into, but that destroys relationships with coworkers.
I think that what I'm speaking to is a little bit of a larger conversation of resources. As a student and how that trickles down to us, there's almost, I've observed this culture of, well, Drexel has to come to me. And as a white cisgender individual, I worry that that's a power or privileged position to take of, these resources need to be given to me, they need to be accessible to me. However, we look outside our window and we're looking at City Hall. I mean, we're amongst so many wonderful opportunities in Philadelphia, but also the internet does have such great resources if you're looking at the right places. So I worry that there's this culture of, instead of bolstering the resources that are already there, that creating resources from the ground up just in Drexel. And how is that being communicated to the student population?
I mean, I just think that there needs to be a culture shift, and folks need to start locating themselves in like every single classroom and every sort of work meeting, and it needs to become ingrained. Like, people don't, like, it should never fall on the person whose pronouns don't match what you think that they should be to have to locate themselves to you, right? It needs to be, again, I just want allies to like move up and do the work. Like, go Google, like, do it, and start to make changes in your practice, in your, whether you're a medical provider or a teacher or a student. Like, be aware of how gendered your language is. Like, just open like little practical mindfulness, right? And like open your awareness to how gendered we speak, how gendered language is, how assumptions are passed around cisness, around straightness, around ethnicity, around, right? How these things are just assumed, and start making cultural shifts. And little shifts like having your classroom introduce themselves with their pronouns every single day, because you know what? Some people's pronouns change. Will just become ingrained in a culture. And then the trick is actually listening to the pronoun the person says and then respecting it.
Okay, so I'm Connie. I'm cis, she, her, right? I'm also a philosopher, so I do a lot of thinking about language and pronouns and such. And I wish that we could just get out of the whole binariness of this, because it doesn't fit with reality, right? And I have to say, as a professor, I really don't like the they, them, their as a use for a singular individual, because what I see in the language is that it always ends up changing the verbs, right? Because we've all been taught that, you know, the verbs change based on, number. And then that interferes with the meaning of language, which is the reference. So people get confused on that. So we need to create a method for either making the they, their, them work with the verbs, right? Or, I'm a philosopher, so I'd be in favor of just blowing up the whole, assumptions about pronouns and creating new ones.
So there are actually, people use ze, they. There are folks that do actually go by pronouns that are non-binary or gender neutral that aren't they. There's, I think Z is probably the most common one, or Zier. That was actually, I think, harder for folks because it wasn't practiced language. It was like a whole new word. I'm here for it. And also,
German philosophers do it all the
but
time.
what I'll say is like, we use gender neutral language all the time. Whose phone is this? Someone left their phone? Did someone leave their phone? Right, we use language, gendered language, or gender neutral language all the time without even thinking. We do it every day. So this is no different. And like, at the end of the day, like, do you care about being grammatically correct, or do you care about respecting someone and making them feel welcomed? And I hope that we're all here because we want to feel like we can respect folks and make folks feel welcome, and that we care more about that than grammar. Though she's changing.
Yeah, so I did also want to point out that there is, a number of writing and grammar resources that do sort of very much validate the use of a singular they. It's been used for hundreds of years. It was actually recognized, I didn't know this until I was preparing for this, but it was recognized as the word of the year in 2015 by the American Dialect Society. Harvard and others have published on this, so I do think that there is a strong argument outside of, this just like respect of people over grammar, that this is also grammatically correct.
I'm not arguing the grammar per se. I'm arguing what I see happen when students write and they're trying to do this is that then the verbs automatically change because we write based on how we've been taught and how our ears hear language. And so they haven't been taught this. And so we either need to start teaching this or create or teach the Z. Or teach the Z or something, you know, because there needs to be some kind of change at that level.
It's also important to remember, like, I'm all about, so sometimes folks go to the like far extreme where then they just start like theying everybody, which like I can totally appreciate, but they is not my pronoun, right? They is an actual distinct pronoun that folks, adapt or take on, right? Just like he and she, right? And I saw this really great meme. I wish I could do presentations only based on memes or therapy only based on memes because I would crush it. It's evidence-based. But like, I saw this really great meme that was like, yo, y'all think pronouns are hard? Like, have you heard about names? Like, we learn new people's names like every single day without even thinking, right? What is so hard about a pronoun? Literally nothing. It just takes practice. So go home, stand in front of your mirror, take a weekend, be like, just practice using they in a sentence, practice using ze, zim, zir, whatever it is, right? Like, just practice. Like, you're gonna be great.
In the back.
So my name's Alex. I identify as she, hers. I am expecting my first child in a few weeks, and it's been really an interesting process because everyone wants to know, is it a boy or a girl? We're not finding out what the anatomical sex of our baby is because, as I tell everybody, anatomical sex has, very little to do with gender identity. My mother-in-law very specifically wants me to refer to the unborn baby as he or she, and every time I say they in a singular sense, she gets really flustered, and I've given like the 30-second spiel about like singular they, and I was just wondering if anyone had any basically like suggestions or kind of tactics that they use when you're talking to somebody who, we all have good intentions and that's why we're at this lecture, but people who, kind of misgender people because they just feel like they should. Maybe they're not bad people. My mother-in-law is a wonderful person, but she is not in tune with this societal change at all. So what kind of tactics can we use as allies with people who are maybe less inclined to just kind of get it or pick it up off the bat?
My name is Kristen, and my pronouns are she, her, hers. I will say I'm in the same boat as you. I'm just like a couple more weeks behind you, expecting my first child. And I will say the thing that I do a lot is I just remind everybody every time. And it can be really hard as someone who, from a conservative-ish family, like I am sometimes made to feel like I'm being a rabble-rouser. But that is my job. I am a rabble-rouser. And every time that my family gives me a hard time about using gendered pronoun for the baby, it's sometimes I'm like, oh, just a reminder, gender is a construct, and the baby will tell me what gender they are when that time comes. And then that's just the end of the conversation. Ultimately, I think that we think education is this really sweet, polite thing that happens with Hallmark music. And sometimes it's just, I'm going to correct you, and it's not actually a discussion. Being respectful isn't a discussion. It seems a little harsh, but they don't bother me about it anymore.
I appreciate that very much, and I love sort of the audience interaction there. I want to sort of jump a little bit through the next question and then to one that Lane and I think is important. So we're going to get there. So this question is, and very much related to the conversation we're already having, how do you educate colleagues, faculty, and staff who constantly misgender their students even after correction? I placed this question here in the discussion because I kind of figured we would cover some of the policies and some of the sort of strategies for addressing sexual harassment, which of course this is based on what we saw in the video at the beginning. And then I wanted to share a couple of things with you as well. So there's a recent study that came out last year for people who work in adolescent mental health or LGBTQ health. And this is certainly not new to anyone who has been in the field or worked with this population before, but that using chosen names, and this also includes pronouns, reduces the odds of depression and suicide in trans youth. And this was a sort of a remarkable study that showed that this is violence towards these kids and towards these youth and towards anyone, adults alike. And so that, you know, I tried to make this connection between this research and with the harassment policy that OED has to really show that, you know, misgendering students, staff, and faculty by pronouns or using, you know, dead names or not using chosen names is an act of violence, and that is considered sexual harassment. And I think that's just like where we're going to leave that. Okay.
Yes.
Skip that one for a second. Definitely skip that one, but
So-
we're coming back. Yes.
Sorry, I have a question. Can you
Yeah.
put the question back up?
Yeah, absolutely.
Because while I appreciate the study, this was my question, or I'm sure maybe
Right.
other people asked it too, but I think even so we recognize that it's violence.
Yes.
We recognize that it's wrong, but my question was, what do we do? Because this is based in not a hypothetical question. This is a actual real question. So do you suggest that, you know, as whether you're a faculty, staff, or student, do you suggest that when people are making mistakes and every time it's corrected, then to cite this paper, say that there's violence happening, especially for those who have multiple marginalized identities? How would you suggest approaching people, especially when we're also talking about power, because power comes into play if you're a student and and your professor is doing it. You're in a very vulnerable place. If you're a faculty member and you know, somebody higher than you is saying something, you're in a vulnerable position, and you know what I mean. So that's what you know. That's my question.
I have a degree and I can't work the microphone. I think that what I come back to, Yasmin, a lot in my head is as a faculty member, you know, as a program director, is policy. And I think that what are not at a department level, but what are the policies at a college and university level? And I don't think that they are there, to your inferred point. I think that what I think about first of all is reporting it. And I respect, as we talked about earlier, the challenges of that for anyone and the self-determination not to. But then I really think about sort of documentation, reporting it, ultimately how is it followed up on. On one level, I want to presume this person lacks training, and, you know, is that something that we can commit to as a department or a college? And if it continues, then, you know, I think about HR and how we warn this person, because I do think at a base level, as the argument's made, this is a hostile act, and ultimately sort of it needs to be dealt with. But I also think it's challenging because to me, it feels like that there's a dearth of individuals who are aware of their power and privilege, usually at administrative levels. And I count myself in that, because you can miss it. What I notice about my cisgenderness is sometimes just it comes out for me in humor. How do I have these moments where I sort of catch that I am a product of this culture, and there are places where I can also, you know, sort of aggress potentially against other people. And so, but I do think that at a base level, that's sort of how I handle it. But I want to respect that departments differ as far as how inclusive they are, and administrators differ as far as how much they feel comfortable sort of looking at their own power, privilege, and being able to have these conversations.
Follow-up question. So we talk a lot about our concerns about the language being put out, administration, and all that, and we talk about how they need to be aware of their privilege, but how can we ensure that they go through that process? Like, are there any trainings that is compulsory for them?
Yeah. So, Dr. Kara in the back.
I can respond to that in terms of, so when Kate mentioned the Dean for Diversity at CNHP, that's me. So welcome everyone, welcome. When you mentioned earlier about, I wrote it down exactly, don't expect to be that the system to support you. Yeah. So there's so many communities within this conversation today that can relate to that statement, right? Whether it be gender, whether it be ethnicity, whether it be race, don't expect to support me. So I can get up in the morning and see those moments where it's like, oh, I leave the door and there it is. But when you had asked, young lady in the parade, when you had asked the question about how to respond and what can you say, there are two very notable practitioners in the arena of cultural proficiency, Sue and Sue, a husband and wife team of they're Americans of Asian descent. And they talk a lot about when these types of interactions happen. Like when people say, sometimes we respond to people with questions that are like, and then you answered them? People will ask questions of us and they expect an answer. So one of the things that people can tangibly do, and young man, you would ask the same thing, that people can tangibly do, and that is, you can literally say to someone, so what about me made you ask that? Yes. Or what about they makes you uncomfortable? Sort of like, we don't have to have the answers, because sometimes people ask things of us and expect us to have an answer and give it to them, as opposed to maybe in terms of saying, well, what about this situation made you uncomfortable? Or what about me made you say that? So that might be a strategy, and Sue talk about this strategy, and if you want to Google, they're prolific in terms of their writing and articles and so forth, so that there may be a lot of opportunities for how you can get that sort of responsive language as opposed to having to be that sort of giving information kind of posture. And then these events like this, prior to this role being assumed and prior to us having such a competent board of diversity, we didn't have such an opportunity like this, and we've had several of these. Last month, or a couple weeks ago, we had one on white anxiety, and we're going to be doing more conversations like this. So I really want you to check your mail, emails, and check at the elevator for the flyers, because we're going to continue these kinds of conversations so we can see these kinds of changes people are asking for. I've already made a note of how many faculty tend to attend these things, so I can make those kind of notes and see how we can make those changes happen, because we're talking about curriculum in some of these conversations as well. So I just want to make sure that I was, sort of made that announcement in that, we have a Dean for Diversity, yet how are these things still happening? They're going to continue to happen. It's how we attend to them and what we deal with them and how we, how responsive are we to them? Because unfortunately, in the arena that we know that universities are microcosms of the world, so until we can change out there, these things are going to transpire here. We have to be, sort of knowledgeable about that and how we're going to attend to them. So I thank you all for your comments and questions. This is phenomenal.
I did agree most pointing at me to point out too, so now available in Career Pathway is also the LGBTQ ally training, which used to only be available in person. So when we're thinking about developing strategies or policies internally for departments or programs, that this is a tool now that is available and accessible, and will soon be accessible to students as well via the Blackboard OED shell. So there are ways that this can be sort of built around. I recognize that we are over time right now. There are two particular questions I still want to get to. Lane needs to run, so I'm going to jump to one. You are welcome to run or stay. It should just be maybe 10 more minutes, but I think these are really critical for the conversation that we're having today. This one came through. So, do you think as faculty we should be outspoken about our own gender or sexual orientations if they are not the cisgender or hetero identities? And so, again, I only sent you all with 2 research papers today. This is the other one, and this one was published this year. It's a qualitative research study of 60 youth in the US and Canada, and it's about helping young people stay afloat. And I thought that this was really important because one of the ways that young people in the United States who are LGBTQ identified tell us that they these are supports for them to stay afloat with their mental health. One of those is visibility, which was directly the question that was asked about. And this quotation came through in this research study. It's so cool to just have different options presented. It's important to have someone exemplify a way to live your life, and that it's okay to be gay, or you can be a dancer or own your own restaurant. You can be a man and be a good cook. You can be whatever. You need someone to show you how to do it somehow. And so I thought this was really powerful and sort of spoke to this question about visibility. And I know, you know, in preparing this panel with Wayne, I brought up this question and we both just kind of looked at each other like, yeah. So I think, you know, living sort of authentically and unapologetically is really powerful. And when you, it's a safe thing for you, it's a strength. Yeah, please.
Yeah, awesome. Like if professors want to be out, but also like if you're not comfortable doing that or disclosing that information, like you are not obligated to do that.
Yeah.
Just wanted to make
Yeah,
that
so I
clear.
certainly recognize, you know, so I'm very out in my professional staff position here as a gay man. I carry a lot of privilege being cisgender and being white, and I certainly, definitely, thank you for making that point. I recognize that this is easier said than done for a lot of people, but that when it is possible and feels comfortable and safe to you, that it is a strategy for, you know, supporting our students and younger sort of community members.
And in addition to that, and I don't know if I read the question wrong, so please correct me if I did, cis and hetero, you know, professors and faculty are, I would love, you know, to have them also identify immediately in order to normalize outness and challenge students like myself who I am cisgender to consider my cisgenderness in this space and all spaces I'm in. And I think it's super important. Social location from our faculty and staff is so important, at least for me as a student, and even more so the privileged and power faculty members, just to really normalize what does power mean in this space, what does privilege mean in this space.
So this is broken one.
Hello. Okay. This is like a really meaningful question for me. It's something I grapple with all the time and have gone back and forth about. But like, if you Google me, like the second thing you're going to probably learn is that I'm trans. And but don't Google me. I'm here as a professional. And that's a decision that I really went back and forth about. Like, what does it mean to be out as a trans person, to be out as a trans therapist? Like, how, as a person who now like owns his own business, right? How will that affect the clients that I support, or the people that might want to see me or not see me based on my identity? But the reality is that I'm a relational therapist, and visibility matters. Like, everyone needs a mirror, right? When your mirror isn't what we have in dominant culture, like if you're not white or you're not straight, like we all need a mirror. And like these research papers, I'm just like, I can't believe they're funded, because it's like, duh. Like, I don't know. It's amazing to me that like that's even a headline, that like trans people won't kill themselves if you like treat them with respect, right? Like, it's just shocking to me that this needs to be taught. But yeah, like, I mean, I chose to be out as trans, and you know, I thank the great Laverne Cox for what she said, and that is, you know, it is, what is the quote? Oh, now I'm blank. You know, it is a radical act, right, to be out and visible as a trans person in a world that does not want us to exist. And so, you know, for me, part of the reason that I feel safe to be out as a trans person is also to recognize that I'm a trans man, which is also more acceptable in society than it is, and to also acknowledge that I'm white, right? Of course, if someone's safety is in danger, I would never say like, yeah, go be visible. Like, the sad reality of the world is that trans women of color have an average life expectancy of 35 years old, right? And also can't, and like there's a difference between me who can choose to be visible, right? Or me whose T gets clocked walking down the street in the ways that affects my safety, right? So for me, it is an act to be visible. And that's very different than somebody who, you know, who quote unquote, you know, T gets clocked, where their safety is in danger just simply walking down the street. But again, like, to me, It is a radical act of social justice to be visible in a world that wants me dead.
So there's one final question that I would like to get to today. And this is one that has come up in so many venues and formats that I've been present at. I've only been a staff member here at Drexel for a short period of time. And this is, it's a twofold question, and I'm gonna try and answer both. Yeah.
This is my question.
Perfect, then take it away.
Where are the gender inclusive bathrooms? When will CNHP take this on as an initiative?
Thank you. Yeah, that's a great question.
Also this building.
Yeah, so
that'd be great too.
I think I paraphrased your CNHP because I'm going to break this down a little bit. We emailed about this a little bit, so thank you. So Drexel University has published on their facilities website all of the single person restrooms in sort of under the purview of Drexel University. I went on the website and I took the table that they have published there, which is the building address, location of the restroom and the number of them. And I just sort of extracted the ones that are sort of under CNHP territory. And as you pointed out, and as is very clear to many people who have worked here in this building, there's nothing in 3 Parkway for staff and faculty who have offices here, as well as students who come here for class, visitors from outside organizations. There's nothing. So you can see just stepping out of the door that on every floor that CNHP owns here, that we just have an open sort of gendered bathroom for male and female.
Yeah, it's just, do you ever watch Hidden Figures, the movie? And it gives me that feeling. Like, so someone that doesn't feel comfortable in either of the restrooms, and they have to run over to Bella?
Yeah, I also want to take this point, I might bite my tongue for this later, but so this was addressed most recently and in the largest format for me in the last executive or the last full faculty and staff meeting, which is great that we get together as faculty and staff here at CNHP. And this was touched on briefly, and I was really sort of appalled at the way that it was addressed, and it was done so just as you said, which was just, well, we do have a single person restroom, you just have to go to Bella or New College building. And I think for people that, and I don't think I'm paraphrasing too strongly there with regard to how that was addressed in that meeting. And so I think that that's incredibly dismissive and again, sort of negates what the issue is here in this building.
I would love to switch all of the men's bathroom to gender, to like non-binary and women, and then that bathroom can be the men's bathroom. I think that sounds like a great solution, because I can just imagine that it was a man who said that.
Yeah.
I think
This one works. I think it's, really, when we look back at the history of bathroom politics, right, and the ways in which, racial segregation was, arguably, bathroom politics, which is what I'm sort of colloquially, lovingly going to refer to them as, is a way to legislate trans people out of existence. And that's really important to remember, and that's a really important way to phrase it, right? Because if I can't go to the bathroom safely, I cannot leave my house, right? And so these arguments over bathrooms and the same, and all the nonsense is really about legislating trans people out of existence, and you can't do that because we gonna keep coming.
Not to dismiss any of the gender issues, but in New College building, we do not have a wheelchair accessible bathroom either. Right. So if you use a wheelchair and you are taking classes in New College, you could conveniently go to Bellet as well. Or you could come all the way over here. So
yeah, I've had students get stuck in, I had a student stuck in the men's room because he couldn't get his chair out.
Yeah.
And I hear this, Dr. Barry.
Yeah.
And the door closes. And then I had to let him in.
So again, I wanted to make sure that this question in particularly ended up, under this panel and sort of on the record here, because of how it was addressed in that latest meeting, and how I just think that if we're going to call that a solution, then we have an issue that we really need to work through right now.
Is it changing it at our main campus where Drexel owns the buildings? Because I know one of the issues here is that we don't own the buildings that we.
I have a small answer. So the last time, so there's a committee here at Drexel University. It's a university level committee, the Gender Inclusive Drexel Committee. They're the ones who published this as well. And so I only have attended one meeting as a guest, the most recent one, and this was brought up. And the strategy from a university perspective is not great. And it is that their sort of first wave approach is to get all of the single stall restrooms that may still be gendered over to compliance of being a gender neutral or a gender inclusive bathroom, which is now city policy, and it's been an executive order for a couple of years. And then the second wave of that would be to look at, from sort of a cost perspective, what they could do about turning over bathrooms like what we have here, which are gendered and not single stall. And that was sort of the, again, I think kind of dismissive answer around how they're going to address that, especially because there are buildings that have no resources, let alone one bathroom in an entire building, but we have zero.
Mm-hmm.
Please, Desmond.
Sorry. I guess, one concern about Drexel, whether they own the buildings or not, is, as you were mentioning, it's city policy, and the American Disabilities Act is also federal policy. So it doesn't matter if we own or rent. It is, this is, for at least for us, we just moved into this building about 3-4 years ago. So this was renovated relatively recently with no consideration for single stall bathrooms or gender inclusivity. So I think in terms of whether it's wheelchair accessibility or other ability accessibility, gender inclusivity, everything, this is, if it's law and we're talking about policies, so this goes back to the question of not having support from the system. Because if it is federal law, let's just go for ADA, and I know this is about this is about gender pronoun workshop, but if we can't even abide by a federal law for that, then how are we, I think it's really important for us to really look at all of these things.
Thank you. Yeah.
My question would be, as a student, what would be the channel for me to express concern about something like that?
That's a great question. So I think in making sure that this question got on the record today, this is sort of my first step in bringing this through, at least what I can do through the Board of Diversity, Equity, and Inclusion. So I would absolutely love to talk to you after this about concerns and about how you can raise those here at CNHP, because I think what we're talking about here is very CNHP specific. I think beyond that, at a university level, your voice is also very welcomed and needed, and someone like Rima would be a sort of a great resource for you to reach out to as we sort of develop, stories and advocacy around this so that we can get this change to finally happen.
Thank you.
Yeah, please, Christian. No.
What I would say is specifically, I think about programs, notably programs that are accredited within the college. As part of that process, you frequently are asked to complete surveys. Generally, they're not something that would show up like in a course evaluation, but any type of survey of a program that you are requested to anonymously participate in, I would argue that's an opportunity to get feedback like that. I also would think about if it's accredited, they're going through a site self-study and your accreditation people are coming in to verify that. That's an opportunity where they will be meeting with students anonymously without any faculty or professional staff, and I would let them know very clearly.
It's a great strategy. Thank you. All right, so with that, I think, there were a couple of questions we didn't get to, and I'm sorry about that, and hopefully we can just sort of continue this conversation at another date. I'll share these slides with everyone who attended today, because at the end here especially, there are many of the resources that we talked about, as well as contact information for the panelists and for myself in thinking about how to continue this conversation afterwards. And yeah, I really appreciate you all coming today and being part of this. This is the first step of, I think, many, and hopefully some quick change that'll happen here. Thank you.